Hello, እንዴት ናችሁ? Today you will see the therapeutic applications of laser. In the previous classes we have been looking the interaction of light with the tissue, and we have seen also physics and technology of lasers. Those concepts are important to apply laser for therapeutic purposes. So in this section we will see the different mechanisms of application of lasers, including the photochemical based application, the photothermal based application, the photoablation based application, and the plasma induced and photo disruption based applications. So lasers can now be regarded as practical and economical tools with unique properties that has been utilized effectively in several applications. Medical, biological, and various chemical and physical investigations use lasers due to their unique advantage. The medical lasers which we are interested are used to facilitate a lot of clinical and therapeutic applications. In spite of their advantages, lasers have also definite hazard by causing serious damage on the tissue of both the patient and the laser operation personnel, so they should be handled carefully. When laser light strikes a tissue surface, it can be reflected, refracted, scattered, absorbed, or transmitted. The fractional intensity that goes into those different processes depend on many factors. The optical properties of the tissue, like its reflectivity, scattering, absorption coefficients, particle size, as well as laser parameters like wavelengths, energy, pulse duration, operation mode, and the output spectral profile affects the interaction. All these effects of light begin with the absorption of electromagnetic radiation or photon. So during absorption, the intensity of an incident light is attenuated by passing through a medium, which is tissue, due to partial conversion of light energy into heat motion or certain vibration of molecules. The ability of the medium to absorb this photon depends on a number of factors. Like I said, mainly the electronic constitution of its atoms and molecules, the wavelengths of radiation or energy of radiation, the thickness of the absorbing layer, and the internal parameters such as temperature or concentration also can affect the interaction. Generally, the laser effect can be direct and indirect. The direct effect occurs from the absorption of photons directly, whereas the indirect effect is produced by the chemical event that is created due to the interaction. So interaction of photons emitted from the laser and the tissue could also affect the laser, the tissue, and that is the indirect effect. The variety of mechanisms or interaction mechanisms may occur when applying laser light to a biological tissue due to specific tissue characteristics as well as laser parameters. The most common laser tissue interaction mechanisms are generally 5. That includes the photochemical reaction, photothermal interaction, photoablation, plasma-induced photoablation, and photodisruption. These mechanisms they are dependent on the intensity of the laser light as well as the interaction time. So the magnitude of the tissue reaction are based on physical characteristics like output of length or frequency, which is the energy, or the intensity will be dependent on the output of length and frequency, the density of the power, the duration treatment, which is the interaction time, as well as the property of the tissue, which is the vascularity of the target tissue, may affect also the magnitude of tissue reaction. As the vascularity of the tissue increases, the absorbing capacity of the tissue will increase, so the magnitude of tissue interaction also will be increased. The first light-induced process that we see in tissue is the photochemical process. In photochemical interaction mechanisms, light can induce chemical effects interactions within the micromolecules or tissue. The photochemical effect occurs as a result of direct excitation of electronic bonds by the laser energy. These reactions generally do not result in a significant rise in temperature because they are applied at low intensity of light. The photochemical effects involve either a change in the course of biochemical reaction due to the presence of an electromagnetic field, or photo decomposition due to high energy photons that rupture molecular bonds. So as the name implies, photochemical process changes the molecular structure of the tissue. So one of the photochemical process is photon fragmentation. In photon fragmentation, the original molecule decomposes into smaller chemical fragments by the cleavage of a chemical bond. So breakage of this chemical bond occurs when light interacts with it. This type of reaction is very common in biomolecules when exposed to short wavelength ultraviolet light. The other one is photoisomerization. This refers to a change in geometry when light interacts with a tissue. The geometry of molecules could change. Generally, we have trans kind of orientation or isomerization, and cis kind of orientation or geometry. Cis generally indicates that the functional groups are on the same sides of the carbon chain, while the trans convoys that the functional groups are on opposite sides of the carbon chain. So when light interacts with the few tissues, the geometry of molecules could change. This photoisomerization principle is being used in our visual system. The retina absorbs a photon or a light to rotate into a different conformation. This conformation change pushes against the opsin protein, which is found in our body, that initiates rhodopsins. This will begin a chemical signal cascade that can result in a perception of light by the human brain. So it is because of the light interaction with the retina we are able to perceive objects or see things clearly. The other photochemical process is photorearrangement. In photorearrangement, absorption of light causes molecule to rearrange its structure in such a way that atoms are lost, and it just becomes another chemical. So as an example, the 7-dihydrocholesterol in skin upon UV exposure will be changed to vitamin D3. This is very important process that's required in our body. Our skin absorbs ultraviolet light, and it changes this molecule to vitamin D3, which is important for our body. The other photochemical process is photohydration, as the name implies. In this kind of reaction, the excited molecule adds up a water molecule to produce a new product. As an example, the cytosine, upon exposure of ultraviolet light, will produce cytosine hydrate, which is a new product that adds water onto its bonds. In general, the photochemical process is characterized by a negligible temperature rise and enhanced chemical reactions. As the name implies, the light-tissue interaction will result chemical change in the molecule or in the tissue. In most cases, wavelengths in the visible range are used because of their high penetration depths. Several applications of these photochemical interaction mechanisms have been used, including the photodynamic therapy, the photosynthesis, and the low-level light therapy. Photodynamic therapy is a well-known therapeutic process that uses laser light. We will see this photodynamic therapy principle in detail next. The other light-induced process in tissue is the thermal effect. The most frequently used mechanism of photon energy conversion in laser medicine is heating. So heating of radiated sample occurs with all methods of tissue destruction. That includes coagulation, vaporization, cutting. So photons absorbed by the tissue are thought to cause biological effects through non-specific photothermal effects caused by kinetic mechanism. The external energy from the laser photons will be deposited into the target materials through translational, rotational, or vibrational modes of movement of target molecules. The rotational and vibrational modes of movement, which are in fact criteria of temperature or kinetic energy of the target molecules, are the ones that cause this heating effect or thermal effect. So this extracted energy from the incident light will be most efficient when the frequency of the incident photons is close to the characteristic frequency of these modes that will result is resonance absorption. So at resonance there will be high energy transfer. So these thermal effects they result from the conversion of energy of light, which is absorbed in tissue, to heat. So vibrational or rotational energy in the excited molecule will be transferred to a colliding molecule as translational kinetic energy into another molecule. So atom which have excited energy status and ground status, when light interacts with atom, the electron at the ground state will be ejected to the higher energy state. The higher energy state have its own vibrational energy status, and this excited molecule can cause vibration on this excited state, and that vibration could be changed into heat, and this heat could affect the surrounding tissue. So the heating of an area in the tissue can produce generally 4 effects, including coagulation, vaporization, carbonization, and melting, depending on the temperature. So coagulation occurs when the local temperature of the tissue reaches 60 degrees Celsius, whereas vaporization of tissue occurs when the local temperature reaches 100 degrees Celsius. Carbonization, which is changing of organic constituents into carbon, occurs at 150 degrees Celsius, and above that the tissue could melt. So when laser energy is converted into heat in tissue, thermal diffusion begins initially. So the diffusion of heat through the tissue depends on the thermal properties of the irradiated material. The thermal relaxation or cooling phenomenon is influenced by the thermal coefficient of the tissue. So different tissue have different thermal coefficients. So the properties of the surrounding tissue or fluid and the temperature differential between the radiated and non-radiated tissue affects how the tissue responds to the external energy. However, depending on the duration and the peak value of the tissue temperature, different effects like coagulation, carbonization, vaporization, and melting can be distinguished. Photoablation is another light-induced process that results in material decomposition. So materials decompose when exposed to high intense laser radiation. This occurs when the energetic photons of the laser light decomposes the molecules by breaking the chemical bonds. So in this kind of interaction, photoablation, it is due to the volume stress as a result of bond breaking. So this is a process whereby the various cellular and extracellular components are photochemically decomposed by the action of intense UV pulse. So the result would be the release of photofragmented spares from the tissue, causing ablation or etching. This method is very useful for tissue contouring or sculpturing, such as refractive corneal surgery. And so refractive corneal surgery is one method of correcting the corneal or the cornea. The cornea problem, elongation or shrinkage of cornea could cause hyperopia or myopia. So correcting this cornea using photoablation can correct the refractive index of the cornea. So in general, photoablation starts with the absorption of ultraviolet photons. The absorption will cause promotion to repulsive excited status, and that will result in dissociation. The dissociation will cause ejection of fragments, and the end result will be ablation. As you can see, ablation is just the breakage of bonds and release of fragments from the tissue. So depending on the length or the interaction of light with the tissue, different process occur in photoablation. So initially, when the photons get absorbed by the tissue, the resulting will be the promotion of repulsive excited status that results dissociation, which occurs around 0.77 picosecond. At 1.8 picosecond interaction of light with the tissue, ejection of fragments will occur, and at 3.59 approximately at this picosecond, ablation will occur. So most of the ablation work is done with ultraviolet excimer laser. So the main advantage of this ablation technique lies in the precision of dental enamel etching process without thermal damage to adjacent tissues. So in addition to applying this photoablation for cornea correction, this can be used also for dental enamel etching process. Another one is the plasma induced ablation, when using power densities exceeding 10 to the power of 11 watt per meter square in solid, and 10 to the power of 14 watt per centimeter square in air. The pulse duration, if the pulse duration is in picosecond or femtosecond range, multiphoton ionization of atoms and molecules will occur, a phenomena called optical breakdown. The physical effects associated with this optical breakdown are plasma formation and shockwave generation. So if breakdown or optical breakdown occurs inside soft tissue or fluid, cavitations and jet formation may additionally take place. So by means of plasma-induced ablation, very clean and well-defined removal of tissue without evidence of thermal or mechanical damage can be achieved when choosing appropriate laser parameters. So the main reason for this plasma-induced ablation is the electric field produced due to the interaction of light with a tissue. So this field is considerably larger than the average Coulombic attraction between electrons and a nuclei. The most important parameter of plasma-induced ablation is the local electric field, like I said, which determines when optical breakdown is going to be achieved. If the electric field exceeds a certain threshold value, as like in multiphoton ionization of atoms and molecules, optical breakdown will achieve. So the field causes dielectric breakdown of the tissue. This will create a very large free electron density, which are called plasmons in the focal volume of the beam. So this high density plasma that's created due to the dielectric breakdown will strongly absorb another set of lights, or UV, visible, and infrared, and which is called optical breakdown, and leads to another consequence of ablation. Photo disruption is a similar phenomenon, similar to the photoplasma ablation. Picosecond or femtosecond pulses permit the generation of high peak intensity with considerably lower pulse energies. So with these extremely short pulse durations, optical breakdown may be achieved while significantly reducing plasma energy and thus disruptive effects. So during photo disruption, the tissue will split by mechanical forces. In the case of plasma-induced ablation, this process will be spatially confined to the breakdown region. So the photo disruption occurs in soft tissues or fluids under high intensity radiation. The resulting will be plasma formation at high plasma energies. Shock wave will be generated in the tissue that will disrupt the tissue structure by mechanical impact. So mechanical impact is the end result in photo disruption. That mechanical impact will spread into adjacent tissues. So the difference between photo disruption and photoplasma ablation is during photo disruption, the tissue is split by mechanical forces, whereas in plasma-induced ablation is spatially confined to the breakdown region. So photo disruption is a form of minimally invasive surgery, which is used most commonly in ophthalmology using infrared light. Specifically, the neodymium YAG lasers are used to form a plasma in the eye, which then causes acoustic shock wave generation, which in turn affects the tissue part. So the photo disruption divides the tissue, forming thousands of bubbles, tiny bubbles, and this makes it possible to treat the cornea of the abnormal curve. So correcting the abnormal curve means correcting the refractive index of the cornea that will correct the eye disorder. So in general, the light-induced processes are dependent on the intensity and the interaction time. At long intensity and low interaction time and low intensity, the photochemical effects dominate, whereas as the temperature, as the interaction time decreases and the intensity increases, the coagulation and vaporization, which are the thermal effects, will dominate. At larger intensity and short interaction time, the photodisruption process dominates. In general, tissue light interaction can be classified into radiative and non-radiative. The radiative tissue light interaction will result tissue autofluorescence when a photon interacts with the atom. The ground electron will be ejected to excited state electron, and that excited state electron could return back to the ground state by releasing another photon, and that's called fluorescence. So fluorescence from various constituents of the tissue could occur due to the light tissue interaction. The other is non-radiative. The non-radiative light tissue interactions include the photochemical interaction, which occurs at low optical density and longer interaction time. The other is the thermal effects. Light absorption will be converted to heat, and they can produce different effects depending on the temperature, including coagulation, vaporization, carbonization, and melting. Photoablation, it is direct breakage of cellular structure, which occurs when ultraviolet radiation interacts with a tissue, a few optosecond or femtosecond ultraviolet radiation. The other is plasma-induced ablation induced by high intensity and short pulse. The effect is direct leak breakdown will create ionized plasma that interacts with light to produce ablation. Photodisruption, which is characterized by high intensity and short interaction time, is associated with shock wave generation at high pulse intensity, fragmentation, and cutting of the tissue by mechanical forces of shock wave are the end result. Light in general can have both positive effects and negative effects. The positive effects of light in biological tissue is in general, it can regulate the human circadian rhythms like the sleep cycle, secretion of melatonin and cortisol. Light also has an influence on the body physiological parameters such as body temperature, heart rate, and blood pressure, human alertness, cognitive performance, mood also can be affected by light. So in general, the positive effects include the mood, vitality, alertness. Light on the skin also can produce vitamin D, and there is also an application called light therapy, specifically low power light therapy. The negative effects include seasonal affective disorder or SAD, the blue light hazard upon UV radiation to the eye. It can cause also cell death in the eye. Light on the skin can cause also skin cancer. So let's see the biological effects of light of different wavelengths one by one, starting from the ultraviolet. The three primary health benefits of ultraviolet exposure are mainly production of vitamin D, improvement in mood, and increased energy. This occurs in moderate exposure of the UV radiation. The moderate exposure of UV radiation is a good source of vitamin D mainly. This vitamin aids in the regulation of calcium metabolism, insulin secretion, blood pressure, immunity, and cell propagation. Radiation at longer ultraviolet wavelengths around 320 up to 400 nanometer, which is called UVA, plays helpful and essential role in formation of vitamin D by the skin, and also plays harmful role in that it causes sunburn on human skin and cataract in the eye. So any form of radiation actually, including the visible light or radio wave, could potentially be dangerous if highly concentrated into a narrow beam. That is the case. Lasers are concentrated in a narrow beam, so if not handled carefully, they can also damage the tissue or the human system in general. So the beneficial effects again for ultraviolet include it increases elimination of waste products, improve the flow of blood and lymph, has germicidal and antibacterial effect. It can be used to treat rickets that are soft and deformed bones, acne, and it can produce also a tan, but the well-known effect of ultraviolet is production of vitamin D in the skin. Infrared light has also beneficial effects. Infrared therapy has many roles in the human body. This include mainly detoxification, pain relief, reduction of the muscle tension, relaxation, improved circulation, weight loss for people who are looking for reducing their weight, skin purification, lower side effects of diabetes, reducing side effects of diabetes, boosting of the immune system, and lowering blood temperature are the beneficial effects. Heat, it provides also heat and relaxes the skin. It dilates blood vessels and increases circulation, produces chemical change in general and increases metabolism, increases production of perspiration and oil. That's important for dry skin. Deep penetration may relieve also pain in some kind of sore muscles, and it soothes also nerves. White light can have also beneficial effects in general. It relieves pain in the back of the neck and the shoulder, produce some chemical and germicidal effects, and it can also relax muscles. Lights with blue wavelengths, which are supposed to be beneficial during daylight hours because it boosts attention, reaction time, and mood. However, these blue lights have also problems in nighttime. At nighttime, it is bad because they often impede sleep, but generally soothes nerves, improves skin tone, provides some chemical and germicidal effects. They are also used for mild cases of skin eruption and produce little heat, but at night they are harmful. That's why your smartphone have a blue light filter, so you are advised to turn on that blue light filter during night time, and also recommended during daytime. Red light has also many effects. It improves generally skin complexion and builds collagen to diminish wrinkles in the body. It helps to mend the sun damage. May also prevent recurring cold sores from the herpes simplex virus infections. It can improve the health of joints in people with degenerative osteoarthritis of the knee. Red light generally is known by its therapy, which is called red light therapy. It is a therapeutic technique that uses red low-level wavelengths of light to treat skin issues, mainly wrinkles, scars, persistent wounds in the body. It can also improve dry skin, relax muscle, penetrate the deepest because the wavelength is very high. For red light, the wavelength is large, and large wavelengths can penetrate the skin deep, and it also produces heat. So light therapy can be obtained from lamps, which are called therapeutic lamps. So using these therapeutic lamps, we can treat mainly seasonal affective disorder and certain other conditions by exposure of artificial light. Seasonal affective disorders is a type of depression that occurs at a certain time in each year, usually in fall or winter, in countries that are different from the sub-Saharan countries. In sub-Saharan countries, because there is no that much seasonal change, this seasonal affective disorder may not occur. So during light therapy, you'll sit or you can also work near a device called light therapy box or therapeutic lamp. The box gives off bright light that mimics a natural light or outdoor light. So light therapy is thought to affect the brain chemicals linked to mood and sleep. It can ease seasonal affective disorder symptoms. So using light therapy box or therapeutic lamp may also help with other types of depression, sleep disorders, and other conditions. So this light therapy is also known as bright light therapy or phototherapy, and therapeutic lamps that are similar to these pictures can be used for this purpose. So these effects, therapeutic lamps produce thermal or heat, mechanical or chemical change in our body. So through these kinds of effects, therapeutic effects could be achieved. The other well-known application of light or laser light is photodynamic therapy. So photodynamic therapy is a form of phototherapy involving light and photosynthesizing agents or chemical substances. They are used in conjunction with molecular oxygen to cause cell death. So photodynamic therapy has proven ability to kill microbial cells, including bacteria, fungi, and viruses. It is popularly also used in treating acne. So in photodynamic therapy, a specific wavelength of light will be used to activate a photosynthesizer, which is a drug. Then the drug will be either injected, drunk, or introduced to the target tissue to cause oxidative injury to the cell. So photodynamic therapy is characterized by the low irradiance that uses mainly 1 watt per centimeter square laser light, long exposure that ranges seconds to tenths of a minute, and the resulting will be necrosis, which is killing by membrane damage, and apoptosis, which is programmed death caused by oxidative injury. So the steps for photodynamic therapy is the first one is injecting the photosynthesizer or a drug. It can be drunk or topically applied to the skin if you are interested to apply it on for a skin disease. Then second, the photosynthesizer will accumulate in tumors and most liquids from the healthy tissue. Then laser will be applied. The laser radiation incident on the photosynthesizer makes them generate toxic species, which are called singlet oxygens. The toxicities cause cell necrosis and apoptosis, predominantly in the tumor part, and reduced effect on the normal tissues. Then the immune system will clear up the dead cells and attack the remaining malignant cells. So the principle is creating toxic species, which is called singlet oxygen. In air and tissue, the molecular oxygen occurs mainly in triplet state, whereas almost all other molecules are singlet state. So reaction between the triplet and singlet molecules are forbidden by quantum mechanics. So this makes oxygen relatively non-reactive at physiological conditions. But a photosynthesizer, which is a chemical compound that can be promoted to an excited state upon absorption of light, will undergo intersystem crossing with oxygen to produce a singlet oxygen. So this species is highly cytotoxic, rapidly attacking any organic compounds it encounters. It is then rapidly eliminated from cells in average of like 3 microseconds. So the photodynamic therapy reaction is mediated by oxygenous chromospheres. At low light intensity, laser energy is absorbed by these molecules called photosynthesizers or drugs or photoacceptors. So in this case, the light is used for activation of molecules or drugs by specific wavelengths of the laser light. So the absorbing molecule can transfer the energy to another molecule, and these activated molecules can then cause chemical reaction in the surrounding tissue. So the molecule could be transformed into toxic compound, often involving oxygen-free radicals that can cause cellular death through destruction of DNA molecules. This type of reaction is successfully used in photodynamic therapy for tumor removal, where the photo-absorbing molecule are artificially introduced into a tissue before irradiation. So irradiation of cells at certain selected wavelengths will activate some of the native components. So in this way, only specific biochemical reactions as well as whole cellular metabolism can be changed. This type of reaction is believed to form the basis for low power laser effect. So the steps in simple mechanism is the first one is injecting of the drug. Then the drug will accumulate. For example, if we are interested to remove this tumor part, the drug will accumulate throughout both the tumor and the healthy tissue. Selection of light application on this tumor part will activate the singlet oxygen, which are cytotoxic for tumor, that will cause killing of tumors. But for the other, that will be not dangerous, because the light will be selected on this agent only, or in this tumor part only, and that will cause cell death of the tumor. So this way it's possible to remove tumors. As different kinds of photosynthesizers can be used for photodynamic therapy, depending on the parts of the body or the target that we want. The major difference then between different kinds of photosynthesizers is the part of the cells that they target. So unlike radiation therapy, where damage is done by targeting cell DNA itself, most photosynthesizers target other cell structures. So in general, they can be divided into porphyrins, chlorines, and dyes. Examples include the aminolevinic acid, or ALA, the silicon phthalocyanine PC4 or M-tetrahydrophenolachlorine can be used for specific applications. There is a concept called a treatment window in photodynamic therapy. This treatment window is a window with enough drug concentration and enough exposure time and enough oxygen. Beyond this treatment window, the photodynamic therapy will be dangerous. So if the drug concentration is above the threshold value, the body could be toxic or intoxicated, and if the exposure time is above the threshold, complete photobleaching of the drug could occur, and that will make the photodynamic therapy ineffective. And also there should be enough oxygen. If the oxygen is short, or if there is no enough oxygen, the singlet oxygen or the cytotoxic elements that will be produced will not be enough to cause cell death. So the treatment window is a window for optimal application of photodynamic therapy. This depends on drug concentration, dark toxicity, radiant exposure of laser light, and sufficient oxygen supply. So the clinical procedure of PDT can be used for many purposes clinically. PDT in medicine is mainly used to treat esophageal and obstructive lung cancers, dermatology or skin, and cosmetic surgery. Usually or commonly, photodynamic therapy is used for dermatology or skin cancer. Other applications which are in clinical trial include treatment of prostate cancer, head and neck cancer, skin cancer, breast cancer, and gynecology malignancies are also other applications or potential applications. When you see the skin photodynamic therapy, all procedures of photodynamic therapy, the first is application of the photosynthesizer. So in this case, the photosynthesizer liquid or cream will be applied to the whole area being treated, or the part of the skin that we want to apply photodynamic therapy. Then the medication is allowed to dry or air dry for a few minutes, and then wait for 30 to 60 minutes for the incubation time. So after this proper incubation time, the patient will be brought back into light source room, where select lengths of light will be applied. Then the medication will be activated with that specific length of light. So this photodynamic therapy requires staying out of the sun for 1 day up to 3 days, depending on the area treated. If the person is exposed to additional light, unwanted effects could occur. So this is an example of exposure of light during photodynamic therapy. As you can see, a specific part or the face part will be exposed to light after application of the photosynthesizer to the superficial skin, and the required effect can be achieved if properly applied. Some photosynthesizers are also fluorescent. That means by application of light, they can emit another light. In such cases, they can be used to find malignant cells and guide the photodynamic therapy. As you can see, this photosynthesizer is fluorescent by application of light. It can give light, and that could be used to indicate the area of the skin that is malignant, and this will allow us to select or target the required tissue part to apply effective photodynamic treatment. Photodynamic therapy can be also used for cancer treatment. In the first step of photodynamic therapy for cancer treatment, photosynthesizing agent will be injected into the bloodstream. Then the agent will be absorbed by cells all over the body, but stays in the cancer cell longer than it does in normal cells. And approximately 24 up to 72 hours after injection, when most of the agent has left normal cells but remains in the cancer cells, the tumor is exposed to light that will kill the cancer. So the photosynthesizer in the tumor absorbs light and produces an active form of oxygen and destroys the nearby cells. So in addition to directly killing the cancer cell, photodynamic therapy appears to shrink or destroy tumors mainly in two ways. One, the photosynthesizer can damage the blood vessels in the tumor directly, thereby preventing the cancer from receiving necessary nutrients. The other, the photodynamic therapy may also activate the immune system to attack the tumor cells. So in these two ways, photodynamic therapy can be effective. An example of application of photodynamic therapy for cancer treatment is demonstrated in this picture. As you can see, after injection of the photosynthesizer agent, it's possible to target the tumor part and apply selected wavelengths of light, and that will cause release of a production of singlet oxygens, which causes cell death and the removal of that cancer part or healing of that cancer. The light needed to activate most of the photosynthesizers in photodynamic therapy cannot pass through more than about 1/3 of an inch of fetish, which is around 1 centimeter. For this reason, photodynamic therapy is usually used to treat tumors on or just under the skin or on the lining of internal organs or cavities. This is one major limitation of photodynamic therapy. It is only effective for treatment, and local treatment, and generally cannot be used to treat cancer that has spread or metastasized. So for this reason, photodynamic therapy is limited to application of mainly commonly for skin disease or for the lining of internal organs or cavities. So that's all about this chapter. I hope you have grasped the basic concepts of application of light for therapeutic purposes.